Hi everybody, this is Ben Storbell with Dr. J. Hartley at Hartley Chiropractic and Scoliosis Center. Today I'd like to talk a little bit about adult scoliosis. Dr. J, could you explain how adult scoliosis is treated?
Sure. Adult scoliosis, we go through a program called Mix, Fix, and Set. It's a warming up of the spine to get the spine more pliable, to get it loosened up. Then we do the very specific adjustment called the fix, and then we do the set, which are very specific exercises and traction to get everything to hold. And then in some complicated cases, we will also use ScoliBrace, which is a rigid brace that we found very effective in advanced adult scoliosis where there's ligament damage present.
So how would somebody go about seeking treatment? Do they come in the office, get different x-rays? How are the x-rays analyzed to develop their specific treatment?
Sure. Well, if the patient is coming from far away, another country, something like that, sometimes we will do just an initial phone consultation where they will email us their x-rays and we can give them a rough idea of what they can expect. So people are welcome to do that. And when they come in the office, we do a very detailed evaluation to determine if they do have a scoliosis, what's the level of scoliosis. We find out, did it start as a child, or are they now an adult and all of a sudden it's been discovered that they have scoliosis. And then based on the x-rays, we set that treatment plan of the very specific mix, fix, set, and potential bracing to correct their scoliosis or to stabilize it. We may be more geared in an adult to get symptoms under control at first and then stabilize the curve.
Okay. Are braces necessary for every scoliosis patient?
So the majority of our scoliosis patients, we do not recommend a brace. The CLEAR Scoliosis Method actually started because bracing was found to be ineffective. And so it was a treatment that combined very specific chiropractic with exercise and traction and got very good results. But what we found over time is that some people have very large curves, or they have a developing curve, or as they get older they may be going through hormonal changes, even 60, 70, 80, where the curve is all of a sudden progressing again, or they might have ligament damage. In those patients, we may also prescribe a ScoliBrace.
Okay. So you spoke a little bit earlier about trying to manage the symptoms first. So how important would it be for a new patient or a patient in general to come see the doctor? Or how often should the patient come see the doctor?
Well, we offer two different treatment plans. So if somebody comes in with a severe scoliosis or severe symptoms, we may see them very often. So we might see them daily for 2 weeks. If they're coming in with more of a chronic condition but a smaller curve and they're a local patient, we may see them 3 times a week for 4 weeks. If they're coming from out of town, usually they're doing what's called intensive care, which is where they come in twice a day for 2 weeks.
Okay. Could you speak a little bit about the different types of adult scoliosis?
Sure. So there's adolescent scoliosis in the adult, which means you had scoliosis develop during adolescence, and now as an adult, that scoliosis may be progressing or degenerating and causing you more problems. So that one's called ASA, or adolescent scoliosis in the adult. And then tell me, what other ones do you have to ask about?
The other one I wanted to know a little bit more about adult degenerative scoliosis.
Okay. Adult degenerative scoliosis is where you have one specific vertebra will start to degenerate, and usually on the x-ray you'll see 3 adjacent segments next to each other, and the curve is and usually it's in the lumbar spine. And the patient may have got an x-ray when they were 60 years old and they didn't see any scoliosis at all, and now they're 65 or 70 and they have this progressing scoliosis. So that is adult degenerative scoliosis.
Is there a different method of treatment for each type, or is the treatment the same for all types of adult scoliosis?
Everybody's treatment is modified, very specific to the person. The treatment will look similar in the adolescent scoliosis in the adult and adult degenerative scoliosis. Sometimes there's ligament damage in the adult degenerative scoliosis, so the vertebra may slip to the side, and so in that case we may more likely recommend the ScoliBrace if we see that.
Okay. So after a patient comes in, from what I understand, they have to continue their treatment at home with home exercises. So how important is that in terms of establishing and keeping the correction they've made?
It's very important. It's like if you were to go to the orthodontist and get braces, and you take those braces off, they're going to give you a retainer. So the home exercise is very important. So some patients may have a brace at home. Some patients may have specific exercises we give them. Those have to be done every single day in order to maintain the correction. So we brush our teeth, right? And that's an accepted norm, but our teeth do not have a neurological influence on our health. Your spine has a neurological influence on your health. So even though your spine is more important to your health than your teeth, we tend not to focus on our spine unless we have symptoms. So we talk about the spinal exercises are like brushing your spine, right? And I actually for years have been threatening to make up a toothbrush that says do your spinal exercises, because you know doing your spinal exercises every day is like brushing your teeth, although your spine is more important than your teeth.
Okay. Thank you very much, Dr. J. This was Ben Sturbell with Dr. J. Hartley at Hartley Chiropractic and CLEAR Scoliosis Center. Please subscribe to our YouTube channel, and thank you very much for watching.
Thanks, Ben, and you guys go out and make yourself a great day.